Harold Shipman. Harold Shipman was a British doctor and one of the most prolific serial killers in recorded history. He was born in Nottingham, England in 1946 and graduated from the University of Leeds Medical School in 1970. Shipman worked as a general practitioner in the town of Hyde, Greater Manchester, from 1977 until his arrest in 1998. Shipman's killing spree began in the early 1970s, and he is believed to have murdered at least 218 of his patients over the course of his career. He was able to evade detection for many years due to his position of trust as a doctor, and he was able to manipulate medical records and death certificates to cover up his crimes. Shipman was finally arrested in 1998 after a colleague became suspicious of the high number of deaths that had occurred under his care. He was found guilty of 15 counts of murder and 1 count of forgery in 2000 and was sentenced to life in prison. Shipman committed suicide in his cell in 2004. The case of Harold Shipman has had a significant impact on the medical profession and led to changes in the way doctors are regulated and monitored in the UK. It also highlighted the need for greater scrutiny of medical professionals and the importance of protecting vulnerable patients. Harold Shipman's span of crimes. Harold Shipman's killing spree spanned over a period of more than 2 decades, from the early 1970s until his arrest in 1998. During this time, he is believed to have murdered at least 218 of his patients, mostly elderly women, although the actual number of his victims may be much higher. Shipman's victims were often in good health, and he would administer lethal injections of diamorphine, a powerful painkiller, to bring about their deaths. He would then falsify medical records and death certificates to make it appear as though the patients had died of natural causes. Shipman's crimes went undetected for many years, in part due to his position of trust as a doctor and the fact that he was widely respected within the community. It was only after a colleague became suspicious of the high number of deaths that had occurred under his care that Shipman was finally arrested and charged with murder. How Harold Shipman became a serial killer. It is difficult to know for certain how Harold Shipman became a serial killer, as he never gave a clear explanation for his crimes. However, there are several theories about the factors that may have contributed to his behavior. One theory is that Shipman had a pathological need for control and power, and that his position as a doctor allowed him to exercise this need by controlling the lives and deaths of his patients. He was known to be highly manipulative and to enjoy the attention and praise he received from his patients and colleagues. Another theory is that Shipman had a deep-seated resentment and anger towards elderly women, which may have been rooted in his relationship with his own mother. Shipman's mother had died when he was 17 years old, and he had been responsible for administering her medication in the weeks leading up to her death. Some have speculated that this experience may have contributed to his later crimes. There may also have been other factors at play, such as a lack of empathy or a disregard for the value of human life. Whatever the cause, Shipman's crimes were a shocking and tragic reminder of the dangers that can arise when people in positions of trust abuse their power. How Harold Shipman get caught? Harold Shipman was ultimately caught due to the suspicions of a fellow doctor, Dr. Linda Reynolds. In 1998, Dr. Reynolds had been reviewing the medical records of one of Shipman's patients, Kathleen Grundy, who had died suddenly at the age of 81. Dr. Reynolds noticed that the cause of death listed on Grundy's death certificate was old age, even though Grundy had been in good health prior to her death. Dr. Reynolds believed that the cause of Grundy's death was suspicious, and she contacted the police. An investigation was launched, and it was discovered that Shipman had altered Grundy's will to make himself the sole beneficiary of her estate, and that he had also administered a lethal dose of diamorphine to her. The investigation into Grundy's death led to a wider investigation of Shipman's medical records, and it was discovered that he had a pattern of administering lethal doses of diamorphine to his patients, often altering their medical records and death certificates to cover up his crimes. In September 1998, Shipman was arrested and charged with the murder of Kathleen Grundy. He was later charged with the murders of 14 other patients, and in January 2000, he was found guilty of 15 counts of murder and 1 count of forgery. He was sentenced to life in prison and was found dead in his cell in 2004. Why Harold Shipman is called Dr. Death? Harold Shipman is often referred to as Dr. Death because of the sheer number of his victims and the manner in which he carried out his crimes. Shipman was a doctor and a trusted member of his community, and he used his position of authority to gain access to vulnerable patients whom he then murdered with lethal injections of diamorphine, a powerful painkiller. Shipman's crimes were particularly shocking because they violated the trust that patients place in their doctors, and they highlighted the dangers of allowing medical professionals to operate without adequate oversight and regulation. The nickname, Dr. Death, reflects the magnitude of Shipman's crimes and the profound impact they had on his victims, their families, and the wider community. What are the other names of Harlan Shipman? Harold Shipman was also known as Dr. Death, or the Angel of Death. These nicknames were given to him because of the large number of his patients who died while under his care, and the fact that he was a trusted doctor who betrayed the trust of his patients and their families by deliberately taking their lives. Death of Harold Shipman. Harold Shipman died in prison on January 13, 2004, at the age of 57. He was found hanging in his cell at Wakefield Prison in West Yorkshire, England. Despite efforts to revive him, he was pronounced dead a short time later. The circumstances of Shipman's death remain unclear. Some have suggested that he may have committed suicide, while others have speculated that he may have been murdered by a fellow inmate or that he may have died as a result of foul play. However, an official inquiry into his death concluded that he had taken his own life. Shipman's death brought an end to one of the most shocking and notorious cases in British criminal history. His crimes had a profound impact on his victims, their families, and the wider community, and his legacy serves as a reminder of the dangers of allowing those in positions of trust to abuse their power.